So that is a first-in-human phase 1 study using a bispecific antibody targeting CD3 and CD19. So as we know that most of the bispecifics currently approved are CD3, CD20, so this is a CD19 bispecific antibody. It's designed in such a way to minimize the cytokine release syndrome because the CD3 moiety binds with low affinity to the T cells, leading to release of less cytokine. So it's designed in such a way to minimize the cytokine release syndrome. It also has a longer half-life, so the administration could be done every 2 weeks as outpatient intravenously. And if patients have had a complete remission after cycle 6, they could actually go to once-a-month dosing. So the data that we reported was with the double step-up dosing, which is patients would get a priming dose on day 1 and day 8, and then the target dose is on day 15. And with this approach, we have significantly minimized the cytokine release syndrome, which is mostly now only grade 1 in about 29% of patients. And the neurotoxicity levels have also significantly decreased, and now it's down to 10%. 5% is grade 1, 5% is grade 2. So with the new double-step approach, it is much improved safety profile compared to the previous iterations using either a fixed dosing up front or a single step-up dosing. So that's the safety portion. In terms of the efficacy, we're also reporting the follicular lymphoma cohort. We've had 21 patients. And the overall response so far at this time is 86%, with 76% of these patients achieving a complete remission. Now, this is a single agent activity in a very heavily pretreated patients. There were patients who previously failed CAR T-cell therapy targeting CD19, as well as previously failed also bispecific antibodies, CD20, CD3 bispecifics. So we think this is very promising, and we're still tweaking the dosing to get to the recommended phase 2 dose, which we're expecting probably will be either the next quarter or the quarter after.